What is osteoporosis? Imagine your bones as a complex, living structure, constantly rebuilding and renewing. Now picture osteoporosis as a sneaky intruder, slowly compromising this structure from within. Osteoporosis not only reduces bone mass, but also deteriorates the microarchitecture of bone tissue, making bones more prone to fractures. Proper bone formation relies on a delicate balance of calcium and phosphate, which osteoporosis disrupts, leading to weaker bones. This condition occurs when the creation of new bone doesn't keep up with the removal of old bone. This imbalance involves osteoclasts breaking down bone faster than osteoblasts can build it, resulting in porous and fragile bones. Genetic factors also play a significant role, with specific genetic markers influencing the likelihood of developing osteoporosis. Early stages of osteoporosis can be asymptomatic. This means that individuals often do not realize they have the condition until a fracture occurs. This is why understanding and early detection are crucial. By the time symptoms appear, significant bone loss may have already occurred. Risk factors. While osteoporosis can affect anyone, certain factors increase your likelihood of developing this condition. Age is a significant factor. As we get older, our bones naturally lose some density. This process accelerates for women after menopause due to the drop in estrogen levels, which plays a crucial role in maintaining bone mass. Women are at a higher risk than men, especially postmenopausal women. In fact, of the estimated 10 million Americans with osteoporosis, about 80% are women. Family history also plays a role. If you have a parent or sibling with osteoporosis, your risk is higher. This genetic component underscores the importance of knowing your family's health history. Lifestyle choices can significantly impact your bone health. Smoking, excessive alcohol consumption, and a sedentary lifestyle all increase your risk of osteoporosis. On the flip side, this means that making positive lifestyle changes can help prevent or manage the condition. Certain medical conditions like rheumatoid arthritis, celiac disease, and some types of cancer can also increase your risk. Medications such as long-term use of corticosteroids can also contribute to bone loss. Remember, having risk factors doesn't mean you'll definitely develop osteoporosis. It simply means you should be more vigilant about your bone health and take proactive steps to protect your bones. Don't forget to like and subscribe if this video is helpful. Symptoms and complications. Osteoporosis often progresses without symptoms in its early stages. However, as the condition advances, you might start noticing some telltale signs. One of the most common symptoms is back pain. This is often due to vertebral fractures, which can occur even without a fall or injury. These fractures can be so subtle that they go unnoticed. But over time, they can lead to a noticeable loss of height. You might also notice changes in your posture. A stooped or hunched posture, sometimes called a dowager's hump, can develop as the vertebrae in your spine weaken and compress. Osteoporosis significantly raises the risk of fractures, which can occur from minor incidents like a simple fall, or even routine activities such as bending over or coughing. The most frequent fractures associated with osteoporosis are found in the hip, spine, and wrist. Hip fractures in particular can be especially debilitating, often resulting in a loss of mobility, independence, and an increased risk of mortality. These fractures can severely impact one's quality of life, necessitating comprehensive medical care and rehabilitation. This is why early detection and management are so crucial. They can help prevent these life-altering complications. Prevention and management. We'll break this down into 4 key areas: nutrition, exercise, supplements, and lifestyle changes. Nutrition. A balanced diet is crucial for bone health, but it's not just about calcium. While calcium is important, it's only part of the story. Vitamin D is essential for calcium absorption, but there's another crucial player that often gets overlooked: vitamin K2. A study published in the Journal of Clinical Endocrinology and Metabolism found that vitamin K2 plays a vital role in directing calcium to your bones, rather than your arteries. Without adequate K2, calcium can build up in soft tissues, potentially leading to arterial calcification. Foods rich in vitamin K2 include grass-fed butter, cheese, milk, and egg yolks. Animal proteins are also crucial for bone health. They provide high-quality protein and essential trace minerals. A review published in Nutrition and Metabolism indicates that dietary protein from animal sources is beneficial for bone health, contrary to some beliefs that animal protein leaches calcium from bones. Other minerals like magnesium and boron also play important roles in enhancing bone density. Magnesium helps activate vitamin D, while boron supports the metabolism of calcium and magnesium. We have linked the relevant supplements in the description for you. Exercise. Physical activity is a powerful tool for building and maintaining strong bones. According to Osteoporosis International, weight-bearing exercises like walking, jogging, and strength training are highly effective in improving bone density and reducing the risk of fractures. Resistance training is particularly effective. It not only strengthens bones, but also improves muscle strength and balance, reducing the risk of falls. Start with bodyweight exercises and gradually increase the resistance as you get stronger. Many experts emphasize the importance of resistance training and load-bearing exercise, explaining that these activities stimulate the production of osteocalcin. A study published in Nature in 2013 highlighted that osteocalcin, a hormone produced by bone cells, not only supports bone formation, but also plays a role in cognitive function and metabolism. Don't forget about balance and flexibility exercises. Yoga and Tai Chi can improve balance and reduce stress, which is beneficial for bone health. Chronic stress increases cortisol levels, which can weaken bones over time. Supplements. While it's best to get nutrients from food, supplements can be beneficial, especially if you have dietary restrictions or increased needs. A study from the New England Journal of Medicine demonstrated that supplementation with calcium and vitamin D significantly reduces the risk of hip and other non-vertebral fractures in older adults. However, it's important to note that a reanalysis published in BMJ indicated that calcium supplements, especially without vitamin D, might increase the risk of cardiovascular events. This emphasizes the importance of balanced supplementation under the guidance of a healthcare provider. A combination of vitamins D3 and K2 is often recommended for optimal bone health and calcium metabolism. The two work synergistically. D3 helps absorb calcium, while K2 ensures it's directed to the bones. Strontium is another mineral that has gained attention for its potential to increase bone density. Research published in Osteoporosis International showed that strontium ranelate significantly reduces the risk of both vertebral and non-vertebral fractures in postmenopausal women with osteoporosis. However, its use is not without controversy due to potential side effects, and it can interfere with bone density scans. Lifestyle changes. Small changes in your daily habits can make a big difference in your bone health. Research published in Arthritis Research and Therapy showed that chronic inflammation can accelerate bone loss, highlighting the importance of managing inflammation for bone health. Reducing processed sugars and alcohol can help, as these can interfere with nutrient absorption and bone formation. Quitting smoking is one of the best things you can do for your bones and overall health. Smoking interferes with the body's ability to absorb calcium and decreases estrogen levels. Maintaining a healthy weight is important. Being underweight increases the risk of bone loss and fractures, while obesity can lead to other health issues that indirectly affect bone health. Many experts suggest a holistic approach to managing osteoporosis, which includes regular exercise, optimizing sleep, and considering the role of growth hormone. They point out that growth hormone is crucial for bone density, and one of the best ways to naturally increase growth hormone is through quality sleep and high-intensity exercise. They also highlight the importance of sunlight exposure for vitamin D production, which is crucial for calcium absorption. Just 10 to 30 minutes of midday sun exposure a few times a week can make a significant difference in your vitamin D levels. Living with osteoporosis. If you've been diagnosed with osteoporosis, it's important to remember that you can still lead an active, fulfilling life. Here are some tips for managing daily life with osteoporosis. Fall prevention. Since fractures are the main concern with osteoporosis, preventing falls is crucial. Here are some strategies. Keep your home well lit and free of clutter. Use non-slip mats in the bathroom and kitchen. Wear sturdy, low-heeled shoes. Be cautious when walking on slippery or uneven surfaces. Maintaining an active lifestyle. Regular physical activity is still important, but you may need to modify your exercises. Work with a physical therapist to develop a safe, effective exercise routine. Focus on exercises that improve balance and strengthen the muscles that support your spine. Pain management. If you're experiencing pain from fractures, there are several strategies that can help. Heat or cold therapy. 2. Over-the-counter pain relievers. Gentle stretching and relaxation techniques. Addressing the psychological impact. Living with osteoporosis can be challenging emotionally as well as physically. The fear of fractures and the potential loss of independence can lead to anxiety and depression. It's important to address these feelings. Join a support group to connect with others facing similar challenges. Practice stress reduction techniques like meditation or deep breathing. Consider talking to a therapist if you're struggling with anxiety or depression. It's worth noting that a study published in the Journal of the American Medical Association found that hormone replacement therapy significantly increases bone density and reduces fracture risk in postmenopausal women. Remember, osteoporosis doesn't define you. With proper management and a positive attitude, you can continue to enjoy a high quality of life. Now we suggest you watch our next video on which foods to avoid if you have joint pain. While joint pain and osteoporosis are different conditions, maintaining a healthy diet is important for overall bone and joint health.